all the faculty members, research scholars, and their students. Today, we have assembled for a very noble cause, that is about pharmacovigilance, and in collaboration with the Association of Pharmaceutical Teachers of India. Now, before we go ahead with my speech, I would like to quote one by Moliere, that to undergo treatment, you have to be very healthy, because apart from your sickness, you have to withstand the medicine. This is the basis of any adverse drug reaction monitoring. Now, before any medicine is authorized, I would like to give a brief introduction about it. Before any medicine that is put to market, we have a very limited option as far as its safety profile is concerned. I divide it into two parts. The first part is the animal studies that we carry on. Here, the duration of these trials, it's so small, it is so short, that we cannot get the actual picture. Then starts the clinical trials, the clinical trial 1, clinical trial 2, and the third one. Here again, the sample size, they are very small. Then apart from it, even the duration that is involved. Moreover, the patients that are selected, they are also very selective in the sense with respect to their age, with respect to their sex, and with respect to their health status. So many exclusion-inclusion criteria are involved. And as a result, we may not get the actual pictures of side effects of these drugs. Many of our participants who are mostly students here, they may not be aware of some of the historical events, because the infamous thalidomide disaster that happened in 1957, it was launched in 1957 to treat nausea and vomiting associated with certain pregnant women. In the year 1959, the first report of abnormalities of the newborn baby started coming in. This was followed by 18 more cases, and by the time this drug was withdrawn from the market, 10,000 babies, they were detected with a condition known as phocomelia. Now, this is a condition in which the limbs, the arms and the legs, they are either underdeveloped or they are missing. As a result, you can find these unfortunate babies where the hands are attached directly to the body, or the feet that are directly attached to this. So this was one of the conditions. At that time, the information technology was so weak that it could not be passed upon to much of the audience. As a result, these are 10,000 that is reported, and how many went undetected, that is still not known. And one more case is that of rofecoxib. There is another drug, rofecoxib, COX inhibitor. It was used for the treatment of osteoarthritis and rheumatoid arthritis. But surprising that after about 18 months, there were no reports of any side effects. But after 18 months, when the results started coming in, pouring in, the data was pulled, it was analyzed. It was realized that there was a double risk of patients dying from cardiovascular events. It may be stroke, it may be heart attacks. And as a result, this was ultimately removed from the market. And then there are series of so many drugs, series of drugs that are which have been removed from the market. And here it becomes very imperative. We have a very, we can say, a responsible role as pharmacists, because we are one of the stakeholders of the healthcare systems. So anybody can report this, because we have experts who will be speaking on this, but be it the doctors, be it the nurses, be it the pharmacists, and pharmacists working maybe in hospitals, maybe working in industry, or they may be in any other area, but anybody can report it. In fact, it was in this context that the Pharmacovigilance of India, this was also established of late, and it has come to my knowledge that about 526 centers are there which are meant to report this ADR, adverse drug reaction monitoring they are supposed to take off. But having a center and making it effective, there's a huge difference. This is, I think, this week, it was just to create an awareness amongst the people, amongst the stakeholders, that how to report these adverse drug reactions so that ultimately it benefits the patients. Being a man from pharmacognosy, I would like to emphasize here that there are reports of ADRs even in certain herbal drugs also. The report of betamethasone in herbal products, the report of aristocolic acid, which is a very poisonous substances in certain herbal pharmacies because of misidentification, and so many others related to herbal products are also available. I mean, we can see that there are certain ADRs reported from there. Somebody correctly said that dying from a disease is sometimes unavoidable, but dying from a medicine is totally unacceptable. With these few words, I would like to convey my thanks to all of you for being listening patiently, and wish all the best for this program. Thank you.
It's a matter of great pleasure that today we are holding this seminar on in commemoration of the third Pharmacovigilance Week, which is being celebrated nationwide, on boosting public confidence in pharmacovigilance. In fact, Association of Pharmaceutical Teachers of India is one of the oldest associations which has more than 15,000 members nationwide. And it is a 57-year-old association. But unfortunately, till now we did not have a branch in J&K. Though there was some interim body in place, but there was not much activity. In fact, we couldn't meet ever. So this time it was thought that we should have elections and we should have a proper body in place, and after due elections, after due democratic process, this body was put in place with an objective to connect with our professionals in the rest of the country, to network with them, coordinate with them, communicate with them, and exchange our views and ideas, have such kinds of seminars, workshops and conferences where we can exchange our views and expertise. So today being the National Pharmacovigilance Week, which is starting from 17th and will continue to 23rd of this month, we thought it is prudent to have a seminar on pharmacovigilance need and methods, because most of the members of audience present in this hall are the students of B.Pharm, M.Pharm as well as PhD scholars. So we need to know the basics, the fundamentals of pharmacovigilance. In fact, it's a matter of pleasure for me to inform you all that our department was the first in J&K which conducted a massive study way back in 2005 involving more than 5,600 patients on pharmacovigilance. And that was the first study of its kind, whose these results have been published in a reputed high-impact journal, Journal of Pharmacological and Toxicological Methods. And we thought we should carry this baton forward and carry this mission forward. So today we'll be apprising the students what it means to have a pharmacovigilance center, what is the role of a pharmacovigilance associate, what pharmacovigilance basically is. So we'll try to give you the basic idea so that you also have some interest in future about this particular field and take up research projects and other things in this area. So with these words, I once again welcome our patrons and co-patrons from the central body. As also, we have received more than 500 registrations for this event today for people from Jaipur, Jammu, people from Chandigarh and other universities like Prabha Harjilal College of Pharmacy, Jammu. They are joining from Udaipur and Jaipur and GMN College. Many people have registered for this event. And within in a few more minutes, more of them will be joining us online. So I hope this event will be a very fruitful, productive and useful seminar for all of you. Thank you very much.
Faculty members, research scholars, students, ladies and gentlemen, a very good morning to all of you, and also the participants who have joined us online from different parts of the country as well as abroad. Well, today's awareness program, that is pharmacovigilance needs and methods, is basically in continuation with the ongoing celebration of third week of pharmacovigilance. And in this event, we have just taken a lead and we have organized today's awareness program. Basically, the program is for 1 week from 17th to 23rd of September. And in this, basically, as per the directives of Indian Pharmacopoeia Commission, followed by the directives from the Pharmacy Council of India, we are celebrating today's event. If you take the word pharmacovigilance, it is derived from a Greek word pharmakon, drug, as you know, and Latin term is vigilare. Vigilare means to be aware of the drug. This drug is basically a poison that we take in our daily lives. It is a medicine, but is a poison if not taken in appropriate dosage. Even if you take the paracetamol in high dosage form, like 2 grams, it's going to cause hepatotoxicity. Like other drugs are there, isoniazid, rifampicin, so they again are hepatotoxic unless and until not if taken in the right amount and under the supervision of a registered medicine practitioner. So this is a program that creates awareness about the adverse drug reactions of the drugs. So that is how the government of India initiated a program, that is the Pharmacovigilance program of India, and in which it was basically started in July 2010 with the primary objectives of the program to create a nationwide awareness for patient safety and reporting. And presently there are 250 such centers all over the country, and with 10 of such centers existing in our UT of J&K. Ladies and gentlemen, before we have further lectures of Professor Pir Mohammad Ishaq and our Professor Ziaur Rahman, and let me just brief you about our department, because many people are joining from the outside valley. So our Department of Pharmaceutical Sciences over the past 40 years has been the only government institute in the UT of J&K offering graduate program, and since 2009 it has been offering postgraduate program in 5 different specializations: pharmaceutical chemistry, pharmacology, pharmacognosy, pharmacy practice, and pharmaceutics. And during this entire period, the department has endured to impart pharmacy education of highest quality to its students. The alumni have been well placed outside and within the country. The department has so far awarded 180 M.Pharm graduates, postgraduates, and 16 PhD candidates, besides training more than 750 B.Pharm students. Besides well-equipped laboratories, a department boasts of highly qualified, efficient faculty drawn from different regions of the country, and about total of 200 students of this department have so far cleared the GPAT, GATE, UGC NET, ICMR, JRF, SRF, and also availing DST-inspired PhD fellowships. The department is presently engaged in research in all core disciplines of pharmacy, and has published around 550 research papers in peer-reviewed national and international journals, having impact factor as 11, published 5 books, and has many book chapters to its credit. Department has forged academic collaborations and research ties with premier institutes like Jamia Hamdard, Dipsar New Delhi, SKIMS, SORA, RRIUM Srinagar, IIIM Srinagar and Jammu, GMC, Melody Pharmaceuticals Limited, Naipur Mohali, Sun Pharma, and many more. Department envisages to further strengthen the process of fostering industry-academia interaction by way of enhancing research academic activities through collaboration with reputed MNCs. And in this regard, the department has basically established a Medley chair after signing an MOU with Medley Pharmaceuticals Limited, Mumbai, and seeking the financial assistance of about 30 lakh rupees in addition to some incentives. And under this MOU, the Medley Pharmaceuticals have also pledged support for the grant of salary of 1 professor in pharmaceutics, and also awarding 22-carat gold medal to B.Pharm pass out topper first class first every year. Besides sponsoring 1 B.Pharm pass out of the department for admission to M.Pharm in pharmaceutics and pharmacology in any university in the country. And this year they have sponsored a person in pharmacology because the pharmaceutics person was not available. So the person in pharmacology got admission and he got his fees reimbursed. Ladies and gentlemen, our department has the privilege of having the distinction of basically getting grant by both DST and the FEST. Under DST FEST, we have got the around 1 crore grant, and it was from 16 to 23. And in case of UGC SAP, we got 2 grants, SAP 1 and SAP 2. And SAP 1 was around 56 lakh rupees, and for the SAP 2nd, it was around 1.19 crore. And also pertinent to mention, the department has been running successfully many research projects, both major and minor, in which more than crore rupees have been sanctioned. And right now, 3 projects are ongoing from major funding sources like ICMR, IUCCRM, and JK State Council, and the amount is around 75 lakhs. And department has been according top priority to the placement of its pass-outs in various pharmaceutical concerns, recent ones being the placement drive in IQVIA, Glenmark Laboratories, and HLL Pharmacy. Department of Pharmaceutical Sciences envisages to continue its unflinching mark towards excellence through augmentation of its faculty strength, expansion of existing infrastructure, modernizing of laboratories, industry academic collaboration, and quality research activities. Department aims to carve niche for itself in the national arena of pharmaceutical sciences and emerge as an institution of repute in the times to come. Last but not the least, I would like to place on record my sincere thanks and appreciation to our Honorable Vice Chancellor, and it was only her unflinching support to our department that we got the PCI approval recently from the last 2 years, and also the infrastructure development. Thank you, ladies and gentlemen.